More than 82 million people in the United States live their lives challenged by a movement disorder. Essential tremor, ET, is a chronic, progressive neurological disorder that can occur at any age, including birth. ET is the most populated movement disorder in the world. A far greater percentage of people are diagnosed with ET than any other neurological disease. 500,000 people or more may be afflicted with a related movement disorder known as dystonia. In comparison to Parkinson's, there is a noticeable difference in the lack of sufficient scientific research and public interest in essential tremor and dystonia. ET is a repetitive, involuntary movement which causes parts of the body, such as hands, arms, head, and voice, to tremor. Essential tremor can appear in more than one body part at the same time, marked by bilateral symmetry. ET in both hands can progress to a head and or voice tremor. Although often referred to as benign essential tremor, ET is far from being benign. Essential tremor is quite frustrating, embarrassing, and disabling. People with ET often avoid dining in restaurants, even being seen in public. ET patients tire of being told they are nervous because of voice quivers or hand shaking when signing documents. Legible penmanship is virtually impossible. Essential tremor is an elusive disorder. The cause of ET remains a medical mystery. Brain donation is the only way to solve the mystery of suggested findings that the cerebellum, the basal ganglia, the olivary body on each side of the medulla oblongata may be areas of the brain associated with essential tremor. The Brain Bank, established at Columbia University in New York, will enable doctors to begin to actively study what happens in the brains of people with essential tremor. Doctors will be able to study the changes in brain structure and metabolism that may explain the cause of essential tremor. Call area code 212-305-8513 or email tremor@columbia.edu for further information. Essential tremor is so common yet transparent. Outside of individuals and families afflicted with essential tremor, the public at large is not familiar with ET or misjudges the symptoms of tremor as being Parkinson's and or drug-related. Although known for centuries, essential tremor is like a new disease in that little is known about the exact cause. Initial attempts at understanding essential tremor have had mixed success. The emotional damage of ET is startling. ET does not have any regard for race, age, or sex. Even infants and small children can have essential tremor. You probably know a neighbor, a co-worker, a service club, or faith member who has essential tremor. If not, you may recognize famous people with essential tremor. Patriot Samuel Adams, painter, ivory cutter Magnus Berg, British politician, soldier Oliver Cromwell, 13th Canadian Prime Minister John Diefenbacher, actress Katharine Hepburn, playwright Eugene O'Neill.
Well, what does the word love mean? It means total interest. I think that the reason very few people really fall in love with anyone is that they're not willing to pay the price.
At present, there is no known cure for essential tremor. Generally, treatment for essential tremor is medications, Botox injections, and deep brain stimulation surgery. Therapy varies with each individual, and the effectiveness of therapy can be less than optimal. Essential tremor can worsen, leaving people disabled, unable to perform life's daily activities. Essential tremor can affect employment and has been responsible for wiping out careers. Everyone has a physiologic tremor, which is a normal action present in both children and adults. Usually, the oscillating movement of any body part is hardly noticeable to the naked eye. Physiologic tremor is observable when enhanced by strenuous activity, exhaustion, stress, excitement, or fear. Essential tremor can interfere with a person's ability to perform daily activities. People with ET are self-conscious of their looks and movements. Embarrassment of having ET can lead to emotional damage. ET is responsible for a range of maladies including suffering from depression, to being a recluse with severe social phobia. Stress, fatigue, anxiety, hot or cold weather can worsen ET. Severe essential tremor may cause difficulty in performing activities of daily living such as brushing hair and teeth, holding a glass without spilling, performing self-care like getting dressed, shaving, putting on makeup, using eating utensils, writing and drawing. Essential tremor is usually more pronounced during fine motor activities such as writing or threading a needle. ET also affects speech. ET robs people of their dignity. ET patients usually require medications to perform everyday activities. Medications for both functional and physiological symptoms can include antidepressants, anti-seizure, and/or anti-anxiety medications. Many times, the variety of medications is less than successful in treating essential tremor. People with essential tremor can show a great range of ability to cope with their problems. Some people will need only emotional support from family and friends. Others will need a lot of help, especially with the simple activities of daily living. Many persons with essential tremor have inherited tremor from a mother or father, who in turn inherited tremor from a father or mother. Essential tremor is likely caused by more than one gene, but it is probable that many genes related to tremor have related functional roles, like parts of an engine. Finding these genes, one at a time from a family with that gene, molecular biologists will eventually understand what the essential tremor gene protein products do. Patient bounce is a new terminology that explains why a large percentage of ET patients bounce along from one general neurologist to the next, some not getting properly diagnosed until years later. Patients and physicians have a language barrier because they don't speak the same language. Essential tremor is often misdiagnosed as just nerves. Some doctors tell their patients to just live with it. Deep brain stimulation, DBS, is a surgical option where severe essential tremor does not respond to medication. In this procedure, a hair-thin wire is implanted in areas of the brain and connected to a device called a neurostimulator that is implanted under the collarbone. The neurostimulator sends electrical impulses along the wire to parts of the brain to interrupt signals that cause essential tremor. Patients can turn DBS on when needed and turn it off when tremors are infrequent, such as during sleep. Studies have shown that DBS improves patients' abilities to perform daily activities. Botox injection therapy is used to treat dystonia, a neuromuscular disorder that produces involuntary muscle contractions or spasm that affects muscles that control movement in the eyes, neck, face, voice box, or the smooth muscle in the bladder. The goal of the therapy is to reduce muscle spasm and pain. This potent neurotoxin is the same bacterium that causes food poisoning, or botulism, but only types A, Botox cosmetic, and B, Myoblock, are used as medical treatments. Botox injections do a good job relieving the symptoms of dystonia that affect the face, neck, vocal cords, and arm. They have received a lot of media attention for their use in decreasing facial wrinkles. Originally, this drug was developed for dystonia sufferers and is used in much greater doses. The mission of Tremor Action Network, acronym TAN, is to spread awareness of essential tremor by advocating for a cure through research. Perhaps someday, in the not-too-distant future, medical researchers will find a cure for essential tremor and dystonia.